Dr. Sharp, maybe let's just start with you telling us a little bit about yourself and maybe what inspired you to pursue a career in forensic psychology, and in particular, how you found your way into this very specialized field within forensic psychology.
Sure. Let me see. I'm trying to think how far back I should go. Well, I was a psychology major in college, so I think like many of us folks who go to graduate school for psychology, we demonstrated sort of an early interest in the field. And after graduating from college with my major in psychology, I started working right away. So I started working in a residential program for adults and young adults with major mental illness. So folks who had previously been hospitalized at various points in their lives and who had been transitioned into a residential program. And so I first started working as a mental health counselor right out of undergrad. After I think about 2 or 3 years doing that, I moved. I was thinking about going back to grad school, but I wasn't quite ready yet. And I started working with kids who were involved in the foster care system. So kids who were DCFS involved and who were also living in residential treatment, essentially for emotional and behavioral issues. And in that position, I worked as a case manager, and I started getting a little bit more interested in I guess, how the legal system interacts with the mental health system.
Mhm.
So I think in working with the adults and the children, sort of seeing how the court system made decisions for the children in terms of placement. Some of the clients that I worked with on the adult side had legal involvement. And so I started becoming a little bit more interested in the law and how psychology intersected with the law. Um, and when I was eventually ready to go back to graduate school, I actually applied to law school and to graduate schools in psychology. And at the end of the day, I just couldn't see myself sitting in a class about contracts and things like that. And so when it came down to it, I really sort of realized that, the field of psychology is more my passion, and the field of forensic psychology really seemed like a good marriage
Yeah,
between my two interests. And so that's how I found, yeah, my way to the field.
fantastic. So with forensic psychology is kind of a broad field, maybe for the listeners that we have on tonight, could you talk a little bit about what forensic psychology entails and what role it plays in the legal system?
Yeah, so there's a few different definitions of forensic psychology, but at least for the work that I do, most of the work that I do, forensic psychology entails really the use of psychological knowledge, concepts, research, and its application to the legal system or to the legal
Hmm.
field. And so, for example, some of my internship and postgraduate training was in conducting forensic evaluations. So, conducting evaluations of people's competence or fitness to stand trial,
Hmm.
conducting evaluations of issues related to criminal responsibility. So, whether or not somebody was insane at the time of the crime, um, conducting assessments related to a person's risk for violence as it relates to their mental illness and issues related to civil commitment. And so that's just kind of some examples or some ways that psychological knowledge can inform or can be applied to the legal system in legal concepts.
Yeah, so it's really about it is that intersection, right? It's the intersection of clinical psychology and the legal system, and trying to get a better understanding of how the mental health of individuals who are interacting with the legal system um, are either competent, or how their mental health just has an impact on
Mhm.
um, the behaviors that they engage in, what might have led them to be in the situation that they're in. It's just trying to get a better understanding of who they are and how that maybe put them in the position they're in.
Yeah, exactly. And this has been these concepts have always intersected with the legal system,
Mhm.
historically, even going way back. And so, for example, the concept of competence to stand trial really came about because, when folks would be arrested, in the early days of the United States and even back in England, going back even to Greece and civilizations there, one of the things that would happen is people would refuse to enter a plea, and the way that the court or the king, dealt
Mhm.
with that was that they had to decide whether or not a person was mute of malice or mute by
Mhm.
visitation of God. And one of the ways that they would do that is they would press somebody for a plea. So they would literally put, heavy plates or stones on a person and press them until they entered a plea.
Yeah.
And that's kind of how they would decide whether or not the person was mute by malice or if they were doing it on
Wow.
purpose, or if they were mute by visitation of God, under which case, it wasn't considered the person's fault. And there
Right.
were concessions made with regard to their legal situation.
Oh, that's fascinating. I had never heard that term, mute by malice. So
Hmm.
that's basically someone just refusing to talk. They can talk. And so
Right.
they would squeeze the talk out of them in a really
Yeah.
brutal way.
Yeah. Yeah. Yeah.
Yeah.
Sometimes they didn't actually make it to the actual hearing,
Yeah.
unfortunately.
Yeah.
Yeah. Hmm.
Their tolerance for the squeeze
Yeah.
exceeded their capacity to continue living, I
Right.
guess.
Right. Right. Yeah,
That's
exactly.
horrifying.
Yeah, and similarly, historically as well, concepts around, mental illness and really it not being the fault of the person,
Yeah.
have existed historically related to land disputes, for example. So,
Yeah.
um, um, the legal system used to use the term, an idiot or a lunatic, right?
Hmm.
Um, those were the historical terms that were used, and basically what it came down to is that if the king or the court decided that you were classified as an idiot as opposed to a lunatic, well, they could take your land.
Hmm.
And if you were, classified as a lunatic, basically what that meant was, you might regain your reason, you might regain your sanity, and in that event, you could regain your land back. And so
Okay.
these are, important concepts that, have really been around historically, and that have evolved, throughout the legal system and as society has evolved as well.
That's interesting. As you talk about the role of forensic psychology in the legal system, I kind of hear what I think is like there's an advocacy piece to it, maybe even for lack of a better phrase, like a social justice component to it as well, in terms of just helping understand competence. Is that person, can they be held responsible for what they did? Because it sounds like, if you look back in the history, that was a piece that was just decided on by whoever was presiding over the court, whether that was the king or an appointed judge. Could you talk a little bit about that aspect of it?
Currently or historically
Yeah, no,
or
if you want to throw some of the historical in there, that would be great too. But yeah, I think, in modern society, forensic psychology serves a really, really, really important role. And it's helping a person in some ways get a fair trial, right? It's
right.
it's it's
Right.
setting, it's giving information to the court to make an informed decision about that person's capacity to have acted with intention. I'm not sure if that's the right word,
Sure.
but
Yeah, no, yeah, yeah. So you bring up actually a lot of really important points. And I think the first of which is that when the Constitution was being written, the folks who were involved in that and putting together the Bill of Rights, I mean, they devoted, most of the Bill of Rights were related to the criminal process because, they really realized the important rights that were at stake if you were accused of a crime, that being
yeah,
life, liberty, and property, usually.
yeah,
Um, and so, one of the things that came about is that, if you're accused of a crime, you have a right to be present and confront witnesses. So you have a right to be physically physically present.
Yeah.
And in 1960, there was a case called Dusky v. US. It was a Supreme Court case. And it was during that case where the Supreme Court decided essentially that not only do people have a right to be physically present, for their child, but they have a right to be mentally present as well. And that was sort of the case that set the standard for what we now know today as competence to stand trial.
Yeah.
Um, Insanity is a little bit of a different term. So insanity itself is a legal term. And insanity relates to, the person's mental state at the time of the offense. So were they experiencing symptoms, for example, of mental illness to where they didn't understand that the actions they were doing was wrong,
Hmm.
for example. And the standard is a bit different depending on the jurisdiction, but competence to stand trial is something that is considered to be like in the present. So
Yeah.
currently, is the person able to understand, be mentally present for their proceedings, assist in their defense? And insanity is really in retrospect. So at the time of their
Yeah.
arrest, the time they committed their offense, did they understand that what they were doing was wrong, or could they otherwise not manage their behavior?
Yeah, that's interesting. So there's a couple components of it, right? There's the insanity piece is related to their mental state at the time of the crime, whereas their
Right.
competence is, and I love the way you frame that, and it's something that hadn't occurred to me. But part of getting a fair trial is not just being physically present; it's having the psychological, the cognitive, the emotional capacity to be mentally present and understand what's going on.
Exactly. That's exactly
Yeah.
right. Yeah.
Could we dig into the competence piece a little bit? Could you walk us through the
Mhm.
process of how someone's competence is evaluated and what are kind of some of the key factors that you're looking for in that process?
Yeah, sure. Um, So the issue of competence can be raised at any time after a person's arrest,
Hmm.
an arraignment, essentially. Anyone can raise the issue. Usually it's the defense attorney who raises the issue and who says, I just met with my client and they're talking about how, there's a government conspiracy against them. And, the reason why they assaulted their neighbor is because their neighbor's working for the government and implanted a listening
Hmm.
device, in their fence.
Yeah,
And so I think maybe they're not fully understanding,
sure.
the charges against them in a rational way.
Right.
Um,
There's a little paranoia in there.
right, right. And again, anyone can raise the issue, but oftentimes it's the defense attorney. And
Okay.
so once the defense attorney raises the issue, um, usually what will happen is the judge will have to decide, okay, is there a bona fide doubt of this person's competence? So, everyone who's arrested, you're just presumed competent.
Yeah.
Usually the issue doesn't come up unless there's a bona fide doubt, which basically just means that there's a genuine doubt um, of your competence. And once that bona fide doubt is raised, typically what the judge has to do is order an evaluation. So a more thorough evaluation into that person's competence to stand trial. And so usually at that point is when a psychologist or a psychiatrist will meet with the person.
Hmm.
Um, and they will conduct an evaluation as it relates to their specific abilities and capabilities as it relates to their fitness to stand trial. So some of the things that are examined and discussed during those evaluations are, do you know what your charges are? Do you know what you're being charged with? So there's usually three components, and that is a person's factual understanding of the charges against them, and that is usually like what the name of the charges are. What do the charges mean? So what does assault mean? Well, it means I hit my neighbor over the head, or that I scared them really bad.
All right.
Do they know what a defense attorney's job is? So yeah, I know my defense attorney's job is to help me beat this case. And then there's a rational understanding. So, and that's kind of separate. So, for example, a person might say, yeah, I know my defense attorney's job is to defend me against these charges, but my defense attorney is actually working with and for the government too. So I'm not going to tell my defense attorney anything because they're part of the conspiracy. That would indicate somebody who doesn't have a rational understanding, of the proceedings and the people involved, for example. And then there's this other piece of, can they assist their attorney in their defense? So are they able to identify defense strategies? Are they able to present evidence in their defense? Can they say, I wasn't even there. I was at a basketball game 20 miles away, and I have witnesses who I could call
Mhm.
that'll attest to that. Um, and then, you kind of looking at those things all together. And really the main piece is looking at, does the person have a mental illness or an intellectual disability that impacts those fitness or those competence related abilities? Um,
Mhm.
so those are really the things that we're looking at. And then after the evaluation, the person goes to court where there's usually a hearing.
Mhm.
And the judge will make a decision as to whether or not the person is competent or incompetent.
So a couple things come up for me as you describe that process, Dr. Sharp. One is um, incentive to make that request. And you said it typically comes from defense attorneys. I can't imagine that anyone on the law enforcement side or the prosecutorial side would ever
Mhm,
have an incentive to bring that up. But I'm curious,
mhm.
based on your experience, is that accurate? Does it sometimes come up from the
Yeah.
adversarial side of this process?
It does, and sometimes the judge
Yeah.
as well. And it does. I've seen it come up with the prosecution, where the prosecution believes that a person is unfit. And I think, if I'm thinking idealistically anyway, I think because what happens is, let's say somebody goes through a trial and they're unfit, and then later they appeal, and let's say they're convicted, and they
Yeah.
later appeal their case and say, I wasn't competent.
Mhm.
So I think it behooves everybody involved really to make sure, if there is a genuine question that somebody's not competent, I think
Yeah.
it's really benefit of everybody involved to make sure that they are. And it's also, again, it's a person's constitutional right.
Sure. Yeah. And I don't think anyone wants to be in the newspaper for violating someone's constitutional
Right.
rights,
That's a really good question, though. I mean, again, it doesn't happen often, but I
but it
have seen.
does.
Yeah, yeah.
Yeah. The other thing that occurs to me, kind of on the flip side of this, is the idea of malingering, right? And
Mhm,
as I understand malingering, it is um, kind of loosely termed, faking it, right? It's the idea that you're
mhm, mhm,
trying to present yourself as incompetent or having some sort of particular psychopathology that would would
mhm.
have the court deem you incompetent. How big of a problem is that in this competency assessment process?
That's a great question, and I think the answer will differ depending on, a number of things.
Okay,
So I can say in my own personal experience, I think, out of the, you know, hundreds of clients that we've seen in a community-based setting, I think I've come across, I'm just thinking, I think two.
pretty
So
rare
two out
then.
of, yeah, I would say it might be more common perhaps in an inpatient setting. I've seen some numbers, um, you know, again, it really depends, but I think in a criminal situation or setting, and I don't want to misquote the statistics around it,
Sure,
but I've seen
sure.
anywhere from 12% to 30%, depending
Yeah,
on, which is kind of high, but depending on the particular study. But
yeah,
anecdotally, in terms of my own professional experience, I haven't seen it come up too often, but
pretty low.
occasionally you do. And usually I think the more often way that it manifests itself is that you have someone who does have genuine deficits, and
Sure.
maybe they just exaggerate them a little bit more.
Yeah,
Um, and luckily we do have assessment tools to assess for somebody's, level of effort, if they're
yeah,
exaggerating symptoms, those kinds of things. Uh,
yeah. That was my
so that
next question.
helps.
How do
That
you
helps.
figure out, right? Because I'm sure that there's like ranges of sophistication when it comes to malingering in forensic clients. But so what I hear you saying is that there are kind of tools that are built into the assessment process that would help you detect whether or not someone is presenting in a way that is not real, doesn't match with their actual experience at the time. Yeah.
Yeah, exactly. Yeah. And I think at least when I try to use them, we use them, I think, when necessary,
Hmm.
so a lot of times we'll have folks who come to us who have, a long history of hospitalization and a lot of family collateral data to suggest that this person has been ill for a really long time.
Yeah.
And the day before they're rated. And, oftentimes when you have this longitudinal data coupled with really consistent reports
Yeah.
of other people, it's not always necessary. But
Right.
sometimes when you don't have that, it is an important piece. It's an important thing to rule out.
Yeah, that makes a lot of sense. Yeah, if it's less likely that someone's malingering if they've got this really clearly established history of mental health problems over time.
Usually.
Yeah,
Yeah.
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 It could still happen, but
Yeah.
less
And
likely.
I think too, there's a misconception around, um, so, if you think of malingering in terms of, manifesting symptoms or exaggerating symptoms for like a secondary gain, um,
Hmm.
sometimes I think there's a misconception that if you malinger or if you pretend that you're crazy, that everything goes away. All your charges go away, or you get to go to a hospital instead of a
Yeah.
jail. And that is just not the case. That is not the case.
Yeah, so that kind of brings me to the next question. If someone's found
Hmm.
incompetent to stand trial based on a comprehensive forensic evaluation, what happens? I know you said they don't
Um,
necessarily just kind of get away with it scot-free. I'm
Great
guessing
question.
there's a
So
process, right?
right. So at the hearing, usually what will happen is, expert testimony will be presented as it relates to the person's, whomever conducted the evaluation will state their opinion. So their
Hmm.
expert opinion, related to the person's competence. And usually that's an adversarial hearing, go back and forth, and then the judge makes a decision. And then, now it is different in state to state in terms of the process of what happens after. But in Illinois, for example, what happens after that is that the judge makes a decision. So let's say they decide that you actually are competent. What
Hmm.
happens then is your legal case goes on as it normally would in any other circumstance. Now, if you're found to be incompetent, then the judge has a decision to make. So the judge then will have to decide, okay, does this person need to receive treatment in a hospital on an inpatient basis? Or are they able to be maintained safely in a stable way in the community where they can receive community-based fitness restoration services? And
Okay.
so the judge makes a decision at that juncture. And then typically, the typical course of treatment is a year. So a year from the finding of being found unfit, a person engages in treatment. So their legal situation is technically on hold, but it doesn't go away. It's still
Okay.
there. The charges are still pending while the person receives treatment in order to render them fit for trial.
Okay. So so there's this process that happens if they're determined to be unfit to stand trial, there's there's a restoration, a rehabilitative kind of phase that happens. The trial goes on pause, and then they go into treatment and to kind of down one of two branches, right? There's you talked about the community-based restoration, and then I guess the other is more of an inpatient, traditional
Mhm.
forensic-based restoration setting. Can you talk a little bit about the differences between those two?
Sure. Yeah, also a great question. So, um, most states, if you are found unfit to stand trial, you're likely going to go inpatient to a hospital.
Hmm.
There are now and increasingly more, I want to say maybe, I don't know, again, don't quote me, but I want to say maybe 20 or so states now that have written into their statutes, they allow for individuals to receive fitness restoration treatment in a community-based setting. And so if a person goes to a hospital, they're basically in a locked facility for
Hmm.
however long of a period of time it takes to restore them to fitness. And so they'll be likely attending fitness restoration groups where they go over legal concepts and things of nature. Maybe if they're willing, they'll take medication that might help ease some of their symptoms that are interfering with their fitness related abilities, things like that. And in a community-based setting, it's similar. However, the person gets to remain living in the community while they are undergoing this treatment. So maybe the person has a job, or maybe they're attending school. If we have, for example, we sometimes have adolescent
Hmm.
clients who have been found unfit to stand trial, and they're still going to school. And so they're able to attend fitness restoration treatment on an outpatient basis while they can remain at home with their family, maintain their liberty,
Yeah.
essentially.
Yeah. It's I think of a couple of things. One is just it feels more humane in a lot of ways. If
Hmm.
someone is safe
Hmm.
to be in the community while they're receiving those restoration services, all the better, right? You keep the
Yeah, that's
socialization
exactly
piece
right.
going, keep families intact. There's a lot of
Yep.
good that comes from that, I can imagine.
Yeah, and the other piece that I think is important to mention too is that, you know, the nation really, almost every state is facing what's been called a competency crisis.
Yeah.
That's sort of what it's been dubbed, and essentially what that means is that nationwide referrals for competence to stand trial and folks who have been found incompetent to stand trial have increased really exponentially over the past 20 years or so. And unfortunately, states, hospitals have not been able to meet the need of all
Yeah.
of those forensic patients that are being referred to their hospitals for treatment. And as a result,
I think we lost you there for a minute, Dr. Sharp.
sometimes months and months in jail. Oh, I'm sorry.
I think
Am I
we
back
lost you there
yet?
for just a minute. You were talking about the competency crisis.
That's okay. Okay. Is that where I got kind of became
Yeah, I was kind of
stuck,
right
the competency crisis?
in that spot.
Okay. Um, oh, okay. So basically what I was saying is that what's happening, because there's been such an exponential increase in people being found unfit to stand trial nationwide, state hospitals haven't been able to handle that influx of clients. They don't have enough beds. And so
Yeah.
what we see happening is we have folks with significant mental illness and sometimes intellectual disability waiting in jail for months on end before they can even receive treatment.
Yeah.
Um, and and so there's significant issues there, and community-based restoration programs, there's starting to be more interest in them in many states nationwide to really sort of ease the burden off the state hospital system for
That makes
folks
a lot of sense.
where it's appropriate. Yeah.
Yeah, because not everyone, like you were saying, not everyone needs that inpatient care to go through the restoration process. It's interesting. I live and work in the North Texas area and have been involved in mental health advocacy for a number of years now. And one of the things I
Hmm.
consistently hear, and it's maybe not even on the competency piece, but just in terms of inmates in the county jails who need psychiatric services, it's a tremendous number
Yes.
of incarcerated people who need those services, and there are simply not enough beds
Yeah.
for those psychiatric beds for those people to get the treatment that they need, so they're stuck in jail. And unfortunately,
Right.
the other thing that I've heard very consistently is that they they may not have been competent to stand trial in the first place. They're severely mentally ill, and while they're waiting on a psychiatric bed, they serve out their sentence, having
Yeah,
not
that
gotten the
happens.
treatment that they need. They
Yep.
get released back into the community, still struggling with severe mental illness, commit another
Yep.
crime, and then they're right back where they found themselves.
You got it. That's absolutely right. Yeah, and there's been jurisdictions that are starting to do more research on this sort of process.
Yeah.
And they're finding exactly that oftentimes there is a small subset of folks who they just cycle in and out. They cycle in and out between, in the forensic system, really,
Yeah.
and get caught up in it. Mm-hmm.
Yeah. Probably doesn't do much to actually help their mental state getting caught in a cycle like that. I can see it being a real kind of exacerbating factor for them. Profoundly painful for their
Yeah, and
families
I
as
think
well.
oh, absolutely. And I think too, jail's not a therapeutic place.
No.
It's not meant to be a therapeutic
Right.
place. And so it can often exacerbate, people's symptoms while they're there. And I think one of the benefits of community-based treatment, that we have found that we sort of take a holistic approach
Mhm.
in terms of treating folks. And so, we have a case manager, we have an individual who's assigned to them as their therapist, doing treatment with them. And then we have another separate person who does their evaluation. So somebody who's a little bit more objective in terms of how they're doing. And I think what's really helpful about that model is that we don't take an adversarial approach to working with them,
Right.
so we and like, our treatment providers, they just kind of work on trying to gain rapport first. Will the
Yeah.
person come back? And I really think it's that kind of building relationship model
Yeah.
that does help, I think, facilitate folks staying in the community longer, going longer without a need for hospitalization, going longer without recidivating.
Mhm.
Um, and I think that that's been helpful. I think it's a really promising way to do this kind of work.
I agree. Something that comes to mind for me, Dr. Sharp, I'm thinking about the client who's been determined not competent to stand trial. We were
Mhm,
talking a little bit about malingering earlier, but
mhm,
I can see there being some hesitance to really want to get better, right?
mhm,
Because everything's on hold. I'm not
mhm.
in jail. I haven't been convicted. Can
Yeah.
I play this out long enough? And this kind of ties into a question that I really wanted to ask you about, given the kind of incredible amount of experience that you had. But and so maybe that question intersects with the other question that I wanted to ask you. So I'll just ask them both. What's been one of the
Mhm,
most challenging or impactful cases that you've worked on? And if those two
mhm.
questions aren't related, answer them separately. And if they
No,
are, please.
they really are. There's honestly, Dr. Garrison, there's been so many. I was actually, this is a question I was really sort of thinking about to myself today. And I have to say, all of the clients we have worked with in this program have been unique in their own way and
Yeah,
have, presented with their own unique challenges and have been impactful. I think uh, so I don't know if I can really describe one case in particular.
sure.
But I will say, you know, on a grand scale, most of the clients that we treat, I would say, um, you know, they live in under-resourced areas,
Yeah,
right? So
yeah,
they often, not always, but oftentimes are lacking supportive family members. So
yeah,
the ones that do have supportive family members tend to do better in our program.
sure.
Maybe they've struggled with drugs and alcohol. They're not taking psychiatric medication. Um, we actually had it's also allowed us to see, I think, a number of systemic issues too. Um, so we had one client, for example, who presented to us as incompetent to stand trial. And the offense that he had allegedly perpetrated had actually taken place, I think it was 20 years prior. And
Wow.
I'm like, how did this case take so long to get to us? And it turns out what happened was the charge that he was arrested for, there was some DNA evidence related to it. And that evidence had sat on a shelf untested in a police department for that long.
Wow.
And it actually took, I think it was like some journalist sort of looked into the testing in this one particular town, got everything tested. And, by the time this person actually came to us, this person was in his 70s,
Yeah.
uh, with dementia, and, didn't recollect the crime.
Yeah.
And really, really, it was a challenging case where he had, significant neurocognitive disorder. And so engaging in treatment was really going to be futile. Um, and I guess that was one that stuck with me because I also see our role, and you sort of alluded to this earlier, as
Mhm.
educating the court. So one of the other things that we look at and that we opine about is there
Dr. Sharp, I think we lost you again there.
substantial probability that there's not a probability that they will?
I hate to do this to you, Dr. Sharp.
Um,
We lost you there for a second again.
I thought so. I kind of paused for a minute too, because no, I'm sorry. Where did I get caught off that time?
You know what? I think I lost track looking at a frozen picture, but that's okay.
Sorry.
We're just talking about, the most challenging types of cases, and you were talking about the one client who
Mhm.
had allegedly committed a crime 20 years before, and he's now
Mhm.
in his 70s, he's got dementia, and he doesn't
Mhm.
remember
Mhm.
anything about the alleged crime. And
Yeah,
so the real question at that point, I mean, what do you do with that? That's got to be an incredibly challenging situation to be
it
in.
is. It is exactly because I think, and I don't know if this got cut off or not, but one of the other pieces that we do is I really see our role as also educating, the
Yeah.
court system to say, we also have to stay by law. Is there a substantial probability the person's going to become fit? And,
Yeah.
for somebody with a major neurocognitive disorder, there's not, it's very
Right.
unlikely that they
Yeah.
will. And so those are very difficult cases. I had another case once that was very similar. Um, Not in terms of the DNA not being tested, but there was a case that the person was arrested and this individual was deaf.
Hmm.
Um, but the person grew up in another country in a very small rural area. And so not only were they deaf, they didn't know American Sign Language, and they didn't know the sign language of the country where they were from. Um, it was a congenital deafness that ran in their family, and so the family had their own sort of homespun way of communicating
Yeah.
through signs. Um, and that was another one where we had to say, this person we can't communicate in a way that's going to be meaningful. Their
Yeah.
understanding. And the judge was like, well, is there anything we can do to restore this person to fitness? And really the answer would be like, well, it'd be go back in time and teach them language, and you
Yeah.
can't. And those cases don't come up a lot, but when they do, it's very challenging because the victims on the one hand want justice, and similarly the person on
Yeah.
the other side has a right to be competent,
Yeah.
for the charges. And so those are very difficult cases, and I don't think that society or the legal system has really come to a good response as to what to do in those cases.
Yeah, that's so interesting. And I mean, I can imagine too. I mean, even if conceivably that client could learn over time how to communicate via American Sign Language,
Hmm. Hmm.
that's probably not going to fit within the restoration time window that you're often given, right?
Right, right,
Yeah.
right, right.
Yeah, that is such a difficult balance, right? The justice piece for the victim versus the fairness piece for the person on trial.
Yep.
And as a
Yep.
forensic psychologist, you're right in the middle of that, trying to make a determination about what's best.
Yeah, and I think that is where you really need to be objective. You have to be
Yeah.
neutral,
Yeah.
in terms of your assessment of the person and their abilities and their ability to be, to treatment.
So
Yeah.
we've been talking a lot about competence and fitness to stand trial restoration. I really wanted to ask you, it's been a question for me for a long time, because you hear it, it's big in movies. When it happens in real life, it's often on the front pages of papers. But it's this idea of not guilty by reason of insanity. Can you tell us
Mm-hmm.
what does that actually mean?
Mm-hmm. Mm-hmm. Yeah, so being found not guilty by reason of insanity, and again, this is a historical concept. It's not
Hmm.
new. But I think it's one does have a lot of misconceptions around it. But essentially what it means is that, at the time of the crime, the person was experiencing significant symptoms of an illness, that, and again, the standard for insanity differs depending on what state you're in. Um,
Hmm.
it can be a little bit different, but basically whether those symptoms rendered you unable to understand the nature of what you were doing,
Yeah.
um, or that the nature of what you were doing was wrong.
So you
Um, and,
couldn't.
and
Yeah. No, I was just go ahead, please. I interrupted you.
No, I was just going to give an example.
Yeah, please.
One example I'm thinking is a case that I had worked on previously where an individual had murdered a parent.
Hmm.
And this individual had significant symptoms of schizophrenia, significant religious delusions, and they essentially, had these beliefs that their parent was the devil or some sort of evil spirit,
Yeah.
and that this person was essentially going to bring about the end of the world. And so the person ended up killing their parent, and were so ill and so laboring under these delusional beliefs that when the police came, they thought the police were coming basically to celebrate them, to thank them,
Oh my goodness.
for having done this. I said everybody. Um, and so just to kind of give an example of, I think the way sometimes some delusional beliefs can really impact a person's perception of reality so severely that it really impacts their behavior.
Yeah, and so that brings me back to the idea of competence. I'm
Mhm.
curious, how did that person get through the trial? I guess
Mhm.
there are these
Yeah.
moments, right? You can have a moment during the commission of a crime
Mhm.
where you're legally insane, but by the
Mhm.
time you get to trial, you're competent to stand trial and defend yourself per your
Mhm.
constitutional rights.
Mhm. Mhm. Yeah, I mean, for many folks, it will require psychiatric medication of some
Hmm.
sort. I mean, so for folks who have significant major mental illness, such as schizophrenia, with significant delusional beliefs, or bipolar disorder with psychosis, or those kinds of illnesses, psychiatric medication often really facilitates their
Yeah,
understanding of reality, so that they are able to assist in their defense.
yeah.
In a manner that's adequate. Mhm. But
What
sometimes
happened?
too, even folks without. Yeah.
I was just going to
No, go
ask,
ahead.
I mean, what happens when someone is found not guilty by reason of insanity? I know we said, when you're determined that to be incompetent to stand trial, you're not getting off.
Mhm,
You're just pushing the pause button. But if you're found not
mhm,
guilty by reason of insanity, having been competent to go through the adjudication process for your
mhm.
case, what happens after that? Are you then off scot-free, for lack of a better word?
Yeah. Yeah, that's a good question too. I also think that's something of a misconception,
Yeah.
amongst people. And no, so usually what happens is once somebody is found not guilty by reason of insanity, usually what happens is there's a hearing to determine their need for treatment.
Hmm.
Um, And so just by virtue of the fact of being found not guilty by reason of insanity, it's already been determined that the person has a significant mental illness.
Yeah.
And so oftentimes what happens is, they'll be placed in a hospital for treatment, and they can be there indefinitely. And one of the things that we found that we've seen through research is that, even though there's kind of this misconception that folks, they're not guilty by reason of insanity, so they're getting off scot-free, where
Yeah.
oftentimes it's really not super beneficial for the person from a legal
Yeah.
standpoint. So they often end up remaining in the hospital for many years longer than they would have had they entered a different plea. for example,
Yeah.
or had just been found guilty.
Yeah.
They would often, the prison sentences serving, the associated penalties with whatever the offense is, often carries with it less time than the amount of time that they end up staying in a hospital.
Yeah. And even if they're not in a hospital, sometimes they lose certain individual rights or responsibilities. Is that true with respect to like managing their finances or things like
Yeah.
that?
Sure. I mean, absolutely. I think, one good example, which you might be familiar with, maybe some younger folks on here might not, but John Hinckley Jr.
Hmm.
So that was probably one of the most famous insanity cases in the United States. And, he was found not guilty by reason of insanity after shooting the then president, Ronald Reagan and his press
Yep.
secretary. And he was in St. Elizabeth's Hospital for, I think it was a little over 30 years.
Wow.
After which point he's been since conditionally released. And basically what that means too is that even once a person is released from the hospital, they're still under conditions of the court. And
Yeah.
so like, for him, it was, you can't, you can only use the internet at certain times and it has to be monitored. And you have
Yeah.
somebody who's making sure you're not looking up pictures of Jodie Foster, whatever,
Right.
uh, you know, whatever it is. So yeah, I mean, and you have to take your medication, your court order to make sure you do that and
Yeah.
that you're still engaging in treatment. So oftentimes, yeah, their life and liberty is still limited, long
Right.
after. Yeah.
Yeah. He had the equivalent of a 30-year sentence with extensive
Mhm.
parole requirements after his release. So it's not really
Right.
getting off, getting that
Exactly.
verdict. That's
Right.
interesting. We've been talking a lot about your role as a clinical forensic psychologist, Dr. Sharpe. I wonder if we could change lanes for a minute and talk about your role as a faculty member. So as a faculty member, as an educator and mentor of students at the Chicago School, what do you tell your students? What do you emphasize to your students about the realities and the rewards of working in forensic psychology? How do you prep them for kind of the things
Mm.
that you've had to learn and experience over the years as a clinician?
That's a really good question. That's a really great question. I think that, well, for one, I think it's really important to know, to have good insight into your own self,
Yeah,
and to your own interests and your own limitations. Because you're often dealing with folks who are in a population where they themselves have experienced very significant trauma.
yeah,
um, they may not be super cooperative and happy to meet with you because they're in this, legal situation. And so you have to really, I think, be prepared to listen to a lot of and be exposed to a lot of details of the dark side of humanity, if you will.
yeah,
So really
yeah,
difficult things related to that. But on the flip side of it, I think what I find personally really fulfilling is situations where, in my role as an expert, to the court, really being able to educate the legal system around a person's issues and situations so that they better understand it.
hmm,
Um, I find really, really helpful and interesting. And so I think that there's fulfillment in that. And so I think a lot
absolutely.
of what I say to students is really, if you go into this field, you have to remain open, you have to remain curious. So don't go into situations working with clients expecting that you know everything about them. Really allow yourself to be open, curious, and humble. I think are the three things that are really imperative in terms of doing this kind of work.
Absolutely. Talking about the dark side, I'm a clinical psychologist as well. My area of specialization is pediatric psychology. And, one of the things I struggled with early in my career was managing my multiple roles. Or so I'm a clinician,
Mm.
um, I'm a husband, I'm a father, I was a faculty
Mhm.
member at the time, and that can be really difficult. And you talked about you're working with clients, and this has been true for me over the years. I've had some cases that really kind of challenged me personally, and
Mhm, mhm.
so
Yeah.
I'm wondering, maybe could you talk a little bit about how you kind of juggle those multiple identities and keep yourself
Mhm.
together, take care of yourself, and make sure that you're, physically, mentally, and emotionally healthy?
I don't know that I do. I don't know. Um, yeah, I think that's a tough balance, and I think that I think one of the biggest things, and that I'm very thankful for, in my role as faculty member, as part of my role as faculty at the Chicago School, we're, we're granted a clinical day so that we can devote a
Hmm.
day to doing the work that we want to do. And as such, I never feel isolated. I feel like,
Yeah.
my department, my fellow faculty members are a wonderful support system, and they're
Yeah.
great colleagues with whom I consult with on a regular basis, particularly regarding tough cases. And so I
Yeah.
think that ongoing professional consultation is really super important. And that's what helps I think I would say that's probably like the number one biggest thing that
Yeah.
I find helpful. And I think too, as well, now that I'm, kind of mid-career now, that I turn down cases that I think are going to be too difficult for whatever reason.
Yeah. Yep. Having set
And
up
so
some
there are some
boundaries.
cases that I've said no to. Yes, boundaries. That's exact. You nailed it. Absolutely.
Yeah. So I know we're coming up on time, and I want to leave a little bit of time for questions from people who are joining us tonight. But maybe one more question for you, Dr. Sharpe. If you could give one piece of advice to someone who's considering a career in forensic psychology, what would that be?
I think the advice would be to really ask yourself, what interests me in this field?
Yeah.
So I think sometimes, and we all have, at least for those of us in the forensic field, we all have, I think, like a bit of morbid curiosity around, folks who commit crimes and those kinds of
Yeah.
things. And I think to an extent that's absolutely, normal and understandable. But that shouldn't be the driving factor,
Yeah.
for why you want to do this work, because at the end of the day, that's such a little sliver of it.
Hmm.
It's not like, an FBI profiler, for example. So your role is very
Yeah.
different than that. And so, again, I think, if you're somebody who's open and really just curious about people, and I think about, uh, really being sort of a helpful kind of liaison, with the court system and legal system, then then this is a good fit for you.
Yeah. Fantastic. Well, thank you.
Thank
Dr.
you.
Sharp, this has been an awesome conversation. So thank you. Thank you for joining us this evening. I think we'll take a moment. We've got about 8 minutes before we close up the podcast tonight, and we'll open it up to any questions that you might have for Dr. Sharp. We'll keep an eye on the chat. You can just drop it in the chat.
I have a question over here. It's more out of curiosity. As we can see from this conversation that we've all had today, it's not exactly an easy job to do. There's some really tough tasks in it. I would love to know what the most rewarding thing is from the work that you do, because you can tell that it requires a lot of strength and patience,
Mhm.
compartmentalizing. What would that be?
The most rewarding thing. Oh, I mean, I'd say it's a couple of different things. I think, the clients that we see, um, and it's funny, I know, Dr. Belamonte is on this call right now too, and she's the chair of our forensic psychology department, and she's done a lot of this work with me as well. But I think getting to know our clients and getting to know their stories and their histories, um, to me, I find very rewarding. And I think, yeah, we're not necessarily an advocate for the client, because as I said, we're really neutral in our
Yeah.
assessment, and we put forward an objective evaluation. But I do think that those moments when the court values our opinion, or when they listen to our opinion and they say, oh yeah, this makes sense, or yeah, this person, oh, this person's fit now, so we're going to move forward, or this person's not going to be, or the person, whatever it may be, I think that's very rewarding, because it shows that we have two systems, our psychological systems, mental health systems, and a legal system working in tandem, even though they're very different. and working together, I think that really can be quite rewarding. And also too, I think using psychological knowledge to help inform systems and inform policy. And when you see changes in policies and laws that impact our clients, to maybe prevent them from getting to this place in the first place, is also rewarding too.
We have a couple questions in the chat. One is, what's the best or favorite class that you've gotten to teach, Dr. Sharpe?
My favorite class to teach, I say that for, this is like a little secret, an open secret, but every class I teach, I say is my favorite. But I would say that violence risk assessment is one of my favorites to teach, and mental health law is another of my favorite classes to teach.
Okay. And then another question from Macy. Are there career paths for individuals who are thinking about pursuing just the master's degree level in forensic psychology?
Yeah, I mean, there's so many. Um, there's a really big need and, and a lot of space for realm and assisting in the first responder realm. So, for folks that are having mental health crises, acting as co-responders, I've seen lots of jobs available for those, for example. Providing mental health treatment in juvenile justice facilities, in adult prisons, even in the community, both on the victim side and on working with offenders, reintegrating into the community. We have a number of graduates who now work for the state's attorney's office in victim services. So one of our graduates, for example, provides she has a therapy dog. And so, folks who are victims of crimes, particularly kids, for testimony, she works with the dog to help them get through that. So I think there's lots of different possibilities at the master's level.
Fantastic. Stephen was asking, he says, I was wondering for the clients that are released after they were found innocent by reason of insanity, if medication is something they need to have to do, they make sure that they have the ability to get their medications afterward. Oh, okay. I think what he's asking is, so if someone's found not guilty by reason of insanity and medication is kind of a key component for them, is there a
Mhm.
system in place to make sure they get their medication? Is it compelled, or are they just kind of responsible for managing that on their own?
So if they are living in the community, typically, yes, that is part of their conditional release, that they take medication
Mhm.
if that is in fact part of their treatment plan.
Yeah.
And folks who have been found not guilty by reason of insanity, often they have a very low recidivism rate, often because these conditional release programs work, where there are folks who are kind of mandating and monitoring their medication. Mhm.
Yeah, there's a support structure for them after that process.
Exactly.
Yeah.
Exactly. Yep.
Christopher's asking if someone wanted to work toward profiling, would you still
Mhm.
recommend taking forensic psychology? He adds, I love the melding of psychology, law, and advocacy, and that could be a great, fulfilling career.
Mhm.
So
Yeah, I
profiling.
mean, yeah, profiling is really more of a law enforcement tool. And
Hmm.
so it's primarily used within the law enforcement realm. And so I think for folks who are really interested in that, um, I think usually going the law enforcement realm first, and then
Yeah.
maybe exploring from there how a forensic psychology degree might help. We do have, I think we've had 2 or 3 students who have gone on to go into the FBI. And they've said that their degrees are likely going to be of help for them. So I think it really just kind of all depends on what your goals are, but knowing that this degree in and of itself won't make you or help you be a profiler per se, that there's a
Yeah.
lot of other things you need to do, and it's kind of more of in the law enforcement realm. Mhm.
Okay. And then I think this question's from, I want to say Bree or Bray. How does forensic psychology and competency operate in the juvenile system? Is it similar to what you described? Is there a difference between the adult system and the juvenile system when it comes to competency evaluation?
So no, not in Illinois, anyway. So it's the same statute, it's the same standard. Um, so actually one of the things that we're working on now legislatively is addressing that, since adolescents do have different needs. There's different issues related to development and related to trauma that impact their competency. That's not necessarily always related to a mental illness, for example. And so we're working with a team right now in terms of changing the law a little bit, to treat adolescents somewhat differently from adults. But as of right now, it's the same, at least in Illinois.
Thank you. We are right at time, Dr. Sharpe. Would one more question be okay?
Yeah, sure.
So this question's from Serenity. Dr. Sharpe said we remain neutral in our position as a forensic psychologist. What would be a career in forensic psychology that would be more on the client mental health advocacy side of things?
Mm-hmm. Mm-hmm. So, I mean, I don't necessarily see, so I think we wear lots of different hats, so for example, when I'm in my role as an evaluator, I approach the client and the case in a neutral way, to make my opinion. But once I've formed my opinion, acting in a role of educating the court sort of is a sort of a small form of advocacy. You're advocating for your opinion, whatever that may be.
Right.
But I think on the other side, though, when I'm not doing evaluations, I do a lot of advocacy work. So, one of the other things that I do is I try to get involved in looking at laws, looking at legislation, looking at, I think I kind of mentioned this earlier, but, really looking at how do systems and how do the current laws that we have now negatively impact our clients in the first place, and how can we change some of these systems to make them better? So I think you can do both. So when I'm doing an evaluation, I'm neutral and objective, and when I'm over here doing my advocacy work, I'm doing my advocacy work, and I think that's in line with our ethical codes. And so, yeah, I don't think it necessarily has to be separate, just at separate times, different parts of the job.
Well, Dr. Sharpe, I'll close us up and just say thank you again for sharing your time and your expertise with us this evening on Perspectives in Professional Psychology. And thank you so much to everyone who joined us tonight. It was a pleasure to have you here. We will have more of these coming in the near future, so keep an eye out in your email, and we hope you'll join us next time. If we didn't get to your question tonight, Vin too dropped his email address in there. You can send it directly to him, and we'll be sure to reach back out to you with an answer. And with that, we'll close our podcast tonight. Thank you, everyone. Dr. Sharpe, great to see you. And
Thanks so much for having me.
absolutely. Bye, everyone.
Bye. Take care. Thanks, everybody.